I also want to touch on the emergency guidelines the Department of Public Health put together for medical providers in preparation for the surge in cases we are expecting. As in any large-scale crisis situation, a larger number of patients can stress hospitals, staff, equipment, and supplies to the breaking point. It's hard to believe that we're in a period where hospitals might have to make difficult decisions about how to distribute resources like ventilators, but that's the worst-case scenario, and we must plan for it. While we're doing everything we can to ensure that we have all the resources we need, we must also plan for the possibility that the virus hits too many people in too short a period of time. In the worst-case scenario, our Department of Public Health jointly developed guidelines for hospitals in conjunction with ethicists, public health experts, and medical professionals to ensure that no one's background, social standing, or disability is ever considered if such a decision has to be made. These are not conversations that anybody ever wants to have. But over the past few weeks, we heard from many within the healthcare community on the need to issue recommendations on how to equitably and ethically allocate healthcare resources across the system. In these unprecedented times, every state and many individual hospitals are coming up with what are called crisis standards of care. And today, Massachusetts is releasing its recommendations. They are, in fact, just recommendations. They're not mandatory. But we have a moral obligation to ensure that there are transparent and ethical guidelines available to our medical professionals if they have to make these excruciating decisions. These guidelines are based on work that was originally produced by the University of Pittsburgh and has been adopted by many other states along similar guidelines. And they're designed to ensure consistent decision-making and to protect patients' fair access to healthcare services. We expect the guidelines would only be used in true disaster situations, and of course, we're doing everything in our power to prevent these situations from occurring in the first place. However, we owe it to our residents, our frontline healthcare providers, our hospitals, and our citizens to help them through this public health emergency.